Hello, this is John Kanellopoulos, Clinical Professor of Ophthalmology at NYU Medical School in New York and Medical Director of the LaserVision Institute in Athens, Greece. Some very exciting cornea work. This is the KeraClear XT, the first clinical application ever of this inlay keratoprosthesis. You'll see here the donor cornea and a Catina single-use artificial chamber. We use the FS200 Wavelight Alcon femtosecond laser. You see the settings here. We're going to try and just do a pocket 8mm diameter at 400 microns depth. These are the femtosecond laser settings. The chimney, the opening to vent the lamellar separation is 3.5 millimeters in width. You see it being created here with the cornea applanated, and now the lamellar separation with this excellent and extremely fast femtosecond laser. I will go in with a blunt, small cyclodialysis spatula to make sure that the space at 400 microns depth is created. It's very good, it's patent. We'll use Vibix Extra, 0.25% riboflavin, seen here with an olive tip cannula instilled within the pocket and not the surface of the cornea. I want to underline that. And then very high fluence cross-linking, 7.2 joules. This is a higher concentration of riboflavin, 0.25%. versus 0.1%, which is the classic resin purple riboflavin. And in essence, what we're trying to do here is have UV light go through the translucent cornea that is not soaked with riboflavin, reach the pocket, which now has diffused riboflavin over and under it. Remember, the pocket is at 400 microns, and try and get cross-linking. Following this first session of deep collagen cross-linking, I'm scraping the surface of the donor cornea, removing the epithelium, and again 10 minutes of Vibix Extra, 0.25% riboflavin by IV drill, and then a very high fluence session, the second one for this cornea, 7.2 joules, and now again applanating this cornea and taking out a 3.8 millimeter lenticule at 400 microns depth. Again with the FS200 Wavelight femtosecond laser. We saw the applanation before, and now we'll see the trephination of this 3.8 millimeter lenticule. Remember, the prosthesis is 4 millimeters in diameter, but we want the optical head of the prosthesis to fit snug within this trephination. Here you see how easily the lenticule is being removed. Also surgical planes here. And we'll switch microscopes. We're working now on the EX500 microscope, so you can see the keratoprosthesis being implanted through the corneal opening and using a blunt spatula to stretch out the haptics with 12 fenestrations. This is new in this newer model keratoprosthesis that had just come out. First surgery, as I mentioned, here in Athens, October 22nd, 2013. And as I will show you, a very severe patient, which we glued a week ago for cornea perforation. She has significant anterior segment disease. Here you're seeing the vehicle donor cornea with the keratoprosthesis that we worked on before. And we will trephine 9.5 millimeters on the donor cornea and prosthesis together. See it here trephine. And now freehand trephinations with 9 millimeters trephine on the patient's cornea, peribulbar block, entering here a cornea incision. The neovascularization of the host cornea is making our field quite bloody. We'll fill with methylcellulose and then using the curved cornea scissors, complete the host diseased cornea trephination. Again, we're removing 9 millimeters. Also removing here Descevet's membrane, which had detached from the cornea and was attached on the iris. The patient's pseudophakic, as you can see, a little correctopia, and now suturing in a normal PK fashion the combination of the host vehicle cornea that includes the keratoprosthesis. As a donor now, the complex is a donor to the host cornea that we removed. You can see almost full thickness sutures on the donor and almost full thickness on the recipient. Very important to reapproximate the lips of the transplant. And here, transplant and prosthesis together. And immediately on cornea OCT, you can see the fabulous fit of the prosthesis on the donor vehicle cornea. Very exciting surgery. I want to thank you for your attention. Please visit our website, www.brilliantvision.com, for more details about this fascinating surgery. This is John Canelopoulos.